Hey everyone, my name is Kelly Welsh. I am a renal dietitian for approximately 25 years, as well as the Ren.Nu program coordinator. I have had PKD, been diagnosed for about 25 years, the same time.
I'm Thomas Weimbs. I'm a professor at the University of California in Santa Barbara in the Department of Molecular, Cellular, and Developmental Biology. My research lab has been focused on polycystic kidney disease for over 20 years. I'm also one of the founders at Santa Barbara Nutrients that makes product that's based off of the research we made in my lab.
Let's talk about diabetes, chronic kidney disease, and CKD and KetoCitra and the information coming out about that, because this is super exciting. This is new, brand new, and I'd love you to kind of talk about, first of all, maybe the differences between polycystic kidney disease and chronic kidney disease. Let's start there.
Yeah, so chronic kidney disease just essentially means kidneys have somehow been harmed and are on a path where they're becoming what's called highly fibrotic. So there's lots of scar tissue in them. Cells are dying. Cells can become strange and weird and don't do what they're supposed to do. And it's a progressive disease. So chronic kidney disease, CKD, it usually progresses towards kidney failure. The main cause of chronic kidney disease is diabetes, type 2 diabetes. So by far, that's the number one cause, followed by hypertension. But really, diabetes and hypertension usually go hand in hand anyway. And PKD, polycystic kidney disease, essentially the kidneys progress in a very similar way. You have the same fibrosis going on, the same metabolic changes in cells and so on, and it's relentlessly progressing as well. The difference is that the original cause of the disease in PKD is this gene mutation that one would have inherited. So that puts those kidneys kind of on the path towards chronic kidney disease, just right from the get-go. But what we found is that even in polycystic kidney disease, the same factors that lead to the onset of chronic kidney disease in folks with diabetes, for example, they also worsen the chronic kidney disease in PKD. So I don't know if that makes sense right now. And one should think about it in terms of what is really going on in most forms of chronic kidney disease. Those in diabetic chronic kidney disease, the harm to the kidneys is really being done by what is causing diabetes to begin with. And type 2 diabetes is caused by sort of chronic elevation of blood sugar levels due to overconsumption of high carbohydrate foods, which then goes along with chronic elevation of insulin levels. So you have hyperinsulinemia, which then leads to insulin resistance. And then this causes high blood pressure. And all these factors also impact the kidneys. Everybody, I think, knows there's a diabetic foot, for example. Right? So people with type 2 diabetes, might have terrible ulcers on their feet and they might get amputations. There can be blindness caused by diabetes. But the one thing that is probably much more common is the chronic kidney disease. It's very prevalent in people with diabetes that their kidneys will eventually fail. And the problem is always the same. It's always the high glucose, high insulin levels, the hypertension and so on that's causing all the damage. So if one thinks about it rationally, you would want to take away all the reasons why somebody even got diabetes in the first place, right? So you want to take away the overconsumption of high carbohydrate foods and highly processed foods, and which gives you the high blood sugar values and the high insulin values and so on. So you need to think of it in terms of, let's go to the root cause, get rid of those, and then allow things to improve from there. Unfortunately, the standard treatment, even for just type 2 diabetes, is to keep patients on that same high carbohydrate diet that caused all the problems to begin with, and to just simply manage the symptoms, with medication, which I think eventually this will be called medical malpractice in the future. Right now, it is just a standard therapy to just simply medicate the patient rather than getting rid of the original causes of the disease. Well, anyway, you can probably tell I'm very passionate about this. We're actually writing review papers about those topics, just to try to maybe rattle the cages a little bit so that practitioners wake up a little bit to that and start thinking about, okay, what could I really do with all these patients with diabetic kidney disease? And I think the same applies to people with polycystic kidney disease as well.
Yeah. So, what I'm hearing, you said high carbohydrates, high glucose, high insulin levels, high processed food, is that dietary management in diabetes-related CKD so important. So important. So are there any potential risks associated with someone trying the ketogenic diet if they do have diabetic kidney disease?
So, we're not giving out medical advice here, of course. Everyone is their own patient and has their own doctor. And so talk to your own practitioner, your own doctor, your own dietitian, because everyone's situation is different. People have comorbidities and, other problems in addition to the diabetes, let's say. But in general, all the clinical studies that have been done on low carbohydrate, ketogenic metabolic therapy, and people with chronic kidney disease and diabetes, they have all been positive across the board. I would argue there's essentially very little, if any, danger involved. Of course, you can, if you use a dirty keto internet version and it's full of processed products that have keto on the package, I would stay away from those.
Might be low in carbs, but not necessarily high in nutrition. I always call those. Yes.
Exactly right. Yeah. So I think it's really good to get good advice from someone who knows how to do this, someone like yourself, and advise someone, okay, here's a clean way and a safe way to do this. And I think in those cases, I've never really seen any problems, neither reported in the literature nor from all the folks we have been working with.
Right. Obviously, close monitoring of blood sugar as the adjustment is happening as you're starting out is probably really important for sure as your body's adjusting to the state of ketosis for sure. So like KetoCitra, we recommend it obviously when we're working with PKD patients in parallel to them following a ketogenic diet because it's so complementary. Is there a use for KetoCitra in a traditional treatment plan for diabetic who's going to start a ketogenic journey?
I would say so, yeah. I think the same principles apply to any form of chronic kidney disease. You'll want to reduce the blood sugar, the insulin levels, the initial problems that come along with it, but also things like high uric acid levels. And that's actually something, we're doing in my research lab. We have some really interesting and frightening data on uric acid, making things a whole lot worse in kidneys. I think as anyone with chronic kidney disease, I think they can only benefit from taking away all these renal stressors that we talk about in the Ren.Nu program, for example. KetoCitra is really meant to complement all this. It not only can provide the exogenous ketone, beta-hydroxybutyrate, so that somebody maybe doesn't have to be as strict with their ketogenic lifestyle, but it also elevates citrate levels, brings them back up to normal. And that's very common that patients with chronic kidney disease have what's called hypocitraturia, so their citrate levels are just way too low, which increases the risk of these microcrystals from forming, and they can damage the kidneys even further. So I think the same program that we're talking about in the Ren.Nu program would apply to essentially any form of chronic kidney disease.
I think one thing about KetoCitra we didn't mention is that another reason it's super complementary to a ketogenic lifestyle is especially when you're starting out in a ketosis plan, your body experiences that large flushing of electrolytes and sodium fluid, which can lead to the keto flu, which nobody wants. The cool thing to know about the keto flu is that it's actually 100% preventable. So having a product like a medical food like KetoCitra on board, making sure that your electrolytes are replenished, really, really lowers the chance of experiencing or having to go through anything like the keto flu. So that's another thing about KetoCitra that we encourage our patients to have on board before they actually start the journey.
All right. So Kelly, you're a renal dietitian. You run the Ren.Nu program. How can people that are interested in working with you or being part of the Ren.Nu program, how can they find you? Where can they find more information?
So Ren.Nu has its own website, which you can find more information there. Sign up for the next program or sign up for a free call to talk with me to decide if the Ren.Nu program is right for you, if you have further different questions, things like that. Also find us on our PKD Nutrition with Ren.Nu and Santa Barbara Nutrients on Facebook page. You can see me and some other Ren.Nu dietitians as well as Dr. Weimbs on that page and contributing. It's a great tool for education. All right. And Thomas, it is always lovely to talk with you, pick your brain. I know that I speak for all the PKD patients out there that we appreciate so very much the research that you do. Where can people find you? Where can people find your research?
I mean, one popular way of staying up to date with our research and everything that's going on is to join my lab's Facebook group. Just type in Weimbs Lab, search for that. Anyone is welcome to join. You can also head over to the Santa Barbara Nutrients website. There's a lot of resources and information there. I highly recommend the Santa Barbara Nutrients YouTube channel, where there's a lot of content there as well.